sure, Brandis. The first thing I want to talk about is just kind of getting into your head and finding out what influenced you to bring this legislation forward. I think a lot of people were kind of a little bit shocked by it, actually. So tell us why you all of a sudden decided that this was a good idea and something you were going to get behind.
Sure. Throughout my campaign for Senate, I kept saying, look, I don't support Amendment 2 because the legislature should run it through the legislative process. And I really wanted to see it go and be vetted. I want it to be transparent. I want people to be able to add amendments. I want to hear public comment. I want the debate and the discourse that happens in a legislative process that is very different than the take it or leave it offer you get with a constitutional amendment. You can't offer amendments to the constitutional amendment. It really is a very different process. And I just thought it would be better to run it through the legislative process. And then about a month and a half, 2 months ago, I realized that if I was going to say that and nobody was going to actually file the bill, then it was really incumbent upon me to do the research and put the piece of legislation together and file the bill so that we could have this debate and discussion and put it through the process.
So I think there's a lot of questions about what is going to actually be included as the bill stands right now. Of course, like you said, it's subject to amendments. I understand there's several different provisions, and some of them could be broad. Chronic pain, for example, that could be taken in a number of different ways. So there are some questions as to what actually is going to come down. Headaches, as somebody who suffers from chronic migraines, are they going to qualify? PTSD, I know, was one question. So what types of things are we really going to see covered under this bill as you've put it forward?
Sure. So we've actually listed a number of specific conditions. So AIDS, HIV, Crohn's disease, MS, Lou Gehrig's disease, cancer. Those are all listed specific conditions. And we also put a list of specific symptoms. So chronic pain being one, chronic wasting, those types of specific symptoms as well. But what really the goal here is for you to have a long-term relationship with your physician, for your physician to, in their reasonable medical judgment, make a decision that medical cannabis is right for you. But it isn't a one-stop, go in, get a slip, then go to the dispensary and get something. We want you to have a long-term relationship. We want this to be a reasonable medical treatment.
And I want to go a little bit deeper into the PTSD issue because that's something that I've heard from a lot of people in kind of talking about the fact that I was going to be interviewing you. What are the chances of seeing like that coming up, perhaps in committee, somebody proposing to put something regarding PTSD? What are your thoughts on that?
Sure. So I think I had the bill filed for about an hour before I started getting tweets and texts about from veterans who said, look, the Veteran Administration allows medical cannabis for PTSD in the states that offer it. So would you consider adding that? So I haven't done all the research on that to confirm that that's the case, but I'm obviously, as a veteran myself, I'm open-minded to that, and I think that's the great thing about this process is that's something that could be potentially added down the road.
Now let's talk a little bit about regulations and making sure that this is safe. Driving has been a big topic of this. How do we ensure that there are regulations in place similar to what we would have for alcohol to ensure that people aren't driving under the influence of marijuana?
Sure. So I actually was at a summit earlier this week talking about that very issue, and we found what we heard from that summit was 1 out of every 3 drivers involved in a serious accident, so serious bodily harm or a death involved, has a drug in addition to alcohol in their systems. So it's Xanax, it's Ambien, it's marijuana, but they have an additional drug beyond the alcohol in their system. And so I think and there's not a lot of research out there on how much THC, active THC, it considers you impaired under marijuana, whether it's medical or recreational or whatever. There's just not any type of data out there as far as what is impairment. Now some states say 0.05 is the number, but the experts at AAA, the pharmacologists I've talked to, say that's really not based on medical science. That's just kind of the number that they've picked. But it's not like alcohol at all, where we say 0.08 is the number that we know, and we have a lot of data and research behind that.
So is it going to be perhaps a no tolerance sort of situation until we can figure out the science behind it, do you think?
Well, I think that's the question, is we need to do some research. We need to really understand how this affects the human body when it comes to driving. Clearly, I don't think that people who are using medical marijuana within the hour should be getting in their vehicle and driving. clearly that's not the right thing to do. But I would say, I don't think that many people who are using Oxycontin or Ambien should be getting in their car an hour after driving. And so it's hard to parse out, I guess the question is, what is the appropriate amount in your blood and what is active, because the residual of medical marijuana can stay in your body for days or for even weeks sometimes. And so you could get false positive tests when somebody hasn't used marijuana for many, many weeks.
Now, one of the deals under your bill is that counties can decide whether or not they want to have retail dispensaries within their districts.
Right.
Explain to me the reasoning behind including that.
Sure. So obviously we have a variety of different, we have 67 counties in Florida, 67 different opinions on this topic, and you're going to have a lot of people who just say absolutely not. So I think one of the ways you make a county commission, local government feel comfortable is for them to have the ability to say we want 1, we want 2, we want 0 in our community. And you allow local leaders to play a role in making those decisions. And I think that's appropriate and important.
And of course, the $1 million question here is this even going to go anywhere? What have you been hearing from your colleagues in the Senate and of course in the House as well about their thoughts on this? Do you think that it's going to go anywhere?
So it's been amazing how many tweets, not so much tweets, but how many texts I've gotten from members, or phone calls from members that just said, hey, who's carrying the bill in the House? And they haven't been Democrat members, they've been Republican members. And so I think there's a quiet amount of support out there for it. And I think the important thing is this bill has to be focused on the medical area. And it has to be seen as this one step beyond Charlotte's Web, which is the bill that we passed last year. I think people have to see it as medical. If it even feels anything like recreational, the bill is dead. And so this is a bill that will be built on trust. It will be built on relationships that I've built over the last 4 years in the legislature. And I'm cautiously optimistic because I think, I believe, and I think my fellow colleagues in the legislature believe, that they want to see it run through the legislative process.
Now, you mentioned Charlotte's Web. That's been tied up in all of this red tape of how do we regulate it, where's it going to be, who's going to dispense it, all that kind of stuff, and that just seems to be going very slow, if at all.
Sure.
How much of this is a response to that versus perhaps it being a little bit political? I mean, we saw with Amendment 2, 58% of voters voted in favor of it, more than voted for a governor. Is this a response to those voters and saying, we heard you, this is what the majority of you want? Or is it just something to say, okay, the Charlotte's Web is tied up, so let's put something forward that's already in the bag and ready to go?
So I think it's a couple of things. One, I think, as I said at the very beginning, I truly believe this is a bill that needs to run through. This is a piece of this is an idea that needs to run through the legislative process. That to me is incredibly important that it goes through the legislative process. Everything that's going on with Charlotte's Web, the challenge for the Department of Health is there are a lot of challenging issues when you start talking about medical marijuana. How do I bank the people that are doing this? Because banks probably won't be able to do business in many cases with the people that are growing, with the folks that are distributing. If you look at how at the other 23 states, it's a very difficult time for them to enter their money into the banking stream. And so that's a question that you're struggling with.
Let me stop you for a second.
Sure.
Why is that?
Well, the federal government doesn't allow banks to do that type of business, and so it's been a real challenge for business owners who own these types of businesses and banks to continue any type of relationship because the feds will not allow banks to enter these types of relationships.
So despite the fact that President Obama has said that the Department of Justice isn't going to go full bore in going after states who are going against federal law, really, but there is that particular
Sure.
hiccup that's
Right.
holding it back.
And so I think that's a discussion. I don't think that that's necessarily what's holding up Charlotte's Web, but I think that's part of the discussion that needs to be had on a national level, but also on a state level, of how do you deal with this, because you don't want it to be an all-cash business. It's one of the huge concerns that we have. And one of the huge concerns I had about Amendment 2 was how would you enforce that? How would you actually do that? So I think those are the types of things that need to be thought out. I think Charlotte's Web is just gonna bog down in the red tape of them trying to figure out what are the right rules. And frankly, there are provisions in Charlotte's Web that I don't particularly agree with. The fact that you have to own a nursery in Florida for 30 years in order to even be considered a cultivator for Charlotte's Web it is an extremely challenging thing for me to get over, but it was really, a bill that arrived back in the Senate on the 59th or 60th day, and it was a take it or leave it offer. We don't get 61 days to do legislation, we get 60 days. And so we said, we'll take it and we'll come back and address it in the future. This bill is my attempt to partially address what's going on, what some of the problems I see with Charlotte's Web.
And those 58% of voters who voted for Amendment 2, what do you say to them
Well,
about
so
it?
I think I have not talked to a political consultant that doesn't believe that it would be extremely challenging to see the amendment go down in the future. I think you would see the amendment probably pass in 2016, and I think that has to be part of the rationale for why the legislature should take it up and address it through the legislative process. I know it makes a lot of my colleagues uncomfortable, but the simple truth is, to me, this is the right way to do it. I want to see it amended. I want to see it vetted. I want physicians to come give testimony. I want people who have epilepsy and cancer to come talk about how this potentially could affect their lives. You want to hear those stories, because those stories are what impact legislators when they're sitting there listening to this kind of time.
And on that note, United for Care, the campaign that was pushing for Amendment 2, they sent out an email 2 days ago, I think it was, saying basically that they were in full support of your legislation. They were happy to see it proposed, but that's not going to stop them from continuing with their own petition drive to put forth another referendum, or another amendment rather. So if for some reason this doesn't get out of committee or it dies in session, whatever the case may be, perhaps the governor vetoes it. If that happens, any of those scenarios, would you get behind another amendment issue?
I honestly believe that it needs to go through the legislative process. I think there are going to be things that you're going to want to amend in the future, and to say, hey, we've got to go back to the voters every 2 years and try to get 60% in order to pass a simple amendment, something to fix a glitch in the constitutional amendment. To me, that's not the way this type of issue should run. Constitution, to me, is a very sacred document, and it's something that we should not put this kind of legislation in, or this type of issue in. It's just, I think there was a strong message that was sent when it got 58% of the vote. I think we need to recognize that. We need to recognize the challenge of it going in the Constitution in the future, and we need to see this next 2 months, or frankly the next 2 sessions, as a great opportunity to put forward what clearly voters are interested in, and do it in a reasonable, rational, thoughtful way that includes amendments, that includes public discourse, and that includes a lot of debate and discussion, robust debate and discussion amongst the legislature itself.
One more thing, Senator
Sure.
Brandis, how optimistic are you to see this see the light of day?
So I'm cautiously optimistic. I don't think this is by far not a slam dunk. It's going to take a lot of work on both the House and the Senate side. It's going to take a lot of work from the members of the public, contacting their legislators and letting them know how they feel about it, both for and against. Because I've already been contacted by groups that are against this. So I think it's going to take a while to get it through the process. But I think that's the exciting thing about the way the legislature works, is because there is that discussion and debate and that openness to it. This is just a great way to see the process unfold. And we're going to work our chairman and work it like a normal bill, and build trust between the chambers and the leadership and the governor.
I'm notorious for saying last question
Sure.
and then thinking of one more. The amendments that we might see come through, you mentioned those. Are you going to be working to kind of prevent this bill from getting watered down throughout the process?
So I think if you talk today to the different groups, some of the different groups that I've spoken to, you would see one of the major concerns is the ability to have smokables in there. I'm not a physician. I didn't go to medical school. I think that's a medical decision left up to doctors on how to prescribe and what means of delivery they want the medical cannabis to be in. So my opinion is that we leave that up to physicians. I'm not saying that that might be a deal killer, and that might be something that stops the bill going forward. So that might be something that has to be addressed. I think the whole world of PTSD, as we discussed earlier, is something that I think is something that could be added to the bill potentially. If we hear from physicians, if we hear from patients, if we hear from some members of the VA that say this is a legitimate treatment, I think that's something that we should be open-minded to as well. There are those types of things that only come through the legislative process, only come from the debate and discussion in the legislature that will be added or subtracted to the bill over time.
Well, Senator Brandis, I appreciate you taking the time to answer questions today. Is there anything at all that you want to add on this topic?
No, I would say, we're looking for the public to be engaged in this process. It's an incredibly open process. Anybody can come to our committee hearings. Anybody can come watch us. You can watch us on the web, but you can watch this process unfold. This process will probably unfold over the next 2 or 3 months. So I would just ask people to be thoughtful as they're reaching out to the legislature. This is a very challenging issue for many members of the legislature to deal with. And so be thoughtful, be respectful of the process, and understand that if it doesn't happen this year, we're going to be right back in session in January of next year. So this issue will probably come up September, October timeframe if it does fail. But I've asked the governor, and I've talked to the Senate president, and I've simply asked him to be open-minded when this comes through the process.